We are doing our presentation over Competency 5, Engaging in Policy Practice, by Jessica Ursh and Jamie Heckman. According to CSWE, social workers understand that human rights and social justice, as well as social welfare and services, are mediated by policy and its implementation at the federal, state, and local levels. Social workers understand the history and current structures of social policies and services, the role of policy in service delivery, and the role of practice in policy development. Social workers understand their role in policy development and implementation within their practice settings at the micro, meso, and macro levels, and they actively engage in policy practice to effect change within those settings. Social workers recognize and understand the historical, social, cultural, economic, organizational, environmental, and global influences that affect social policy. They're also knowledgeable about policy formulation, analysis, implementation, and evaluation. Social workers that meet this competency are able to identify social policy at the local, state, and federal level that impacts well-being, service delivery, and access to social care. They're able to assess how social welfare and economic policies impact the delivery of and access to social services, and they're able to apply critical thinking to analyze, formulate, and advocate for policies that advance human rights and social, economic, and environmental justice. Social workers use policy every single day when they follow the HIPAA code and when they keep their clients' information confidential. Policies help to protect our clients from discrimination, racism, or bullying. They also help our clients live more productive lives by supplementing their income, providing health care, or by obtaining needed medical treatments. However, sometimes policies enacted to benefit special interests actually produce disastrous social results. John Herrick states that social workers with their intimate knowledge of human needs can provide critical information to policymakers if they can influence the policymaking process. For this assignment, I was to present a case study based off of a client that I'd seen at my practicum. We stated the presenting problems, issues regarding professionalism, engagement assessment, interventions used, and evaluation of the client, research that helped our intervention, the biopsychosocial theories that could apply to the case, major policies that played a part in the case, diversity issues, and ethical principles. In this assignment, I was able to identify social policy at the federal level that impacts service delivery. It's important to be able to identify what social policies can impact, how our clients are able to receive services, and how we are able to navigate to how to get them the services that they need. Through this, I gained skills to critically think about how to get my clients what they need. This assignment is a midterm that I took in our policy class, Social Work 542. We were to pick 3 questions that Professor Stafford provided us and answer them based on the knowledge that we gained throughout the first half of the semester. I was able to identify social policy at all levels, as well as apply critical thinking to analyze and advocate for policies that advance human rights and social, economic, and environmental justice. Through this, I gained additional skills on advocating for my clients and social policies that would help them. In this paper, my group and I explained euthanasia and physician-assisted suicide and what it means in each state that it is legal in. We were able to identify social policy at the state level that impacts well-being and service delivery. We were also able to apply critical thinking to analyze, formulate, and advocate for policies that advance human rights and social, economic, and environmental justice. We did this by identifying how each state law is different regarding physician-assisted suicide and how many physicians are reluctant to practice physician-assisted suicide because of their values. I value self-determination and respecting human dignity from this paper. I also gained more knowledge about euthanasia and physician-assisted suicide and what impacts these laws have made in each state that it is legal or illegal in. I'm completing my practicum at St. John's Home Health and Hospice. When a patient is discharged from the hospital to home health is sometimes necessary when they've had a surgery, they need additional wound care, they have a serious illness that needs monitored, etc. Policy affects both my agency and their patients because in order for my agency to continue to be successful, patients need to have a way to pay for our services, which could include private pay or buy their insurances, such as Medicare or Medicaid. It affects our patients because of the eligibility requirements that community resources base their services on. For example, I come in contact with many older adults that are in need of more help around their homes. In these cases, we contemplate referring them to senior services. However, unless the client is under $17,500 in assets that doesn't include their vehicles or their homes, they would not meet the requirements. Policy also helps create boundaries in my agency because we keep our clients' information confidential. This way, it keeps our agency and our clients protected.
For this assignment, we were to provide a historical overview of a social problem addressed by a policy of our choosing. We were then to analyze the policy by looking at social and financial cost benefits. The paper was to address revisions of the policy, any major controversial issues or unintended consequences related to the policy. The topic of my paper was the Community Mental Health Centers Act of 1963, which is a federal policy that impacted the well-being of those with mental illnesses, the ways in which services were delivered, and determined who was allowed access to these services. This assignment related directly with the first practice behavior for this competency. In this paper, I looked at self-psychology as an intervention for adolescent depression. One of the sections talks about policy implications, where I discussed issues like confidentiality and HIPAA regulations. When treating adolescents, there is an added layer of complexity in knowing what to share with parents and what should stay between the client and therapist. While doing research, I found an article that found that many adolescents will not seek professional help because they are concerned about confidentiality. This led to the suggestion of having school-based mental health services available for students so they can receive help in most cases without their parents being aware of the subject matter. This section of my paper shows competency in policy, practice, behavior 2 because I looked at a policy and assessed how it impacts a specific population and its access to social services like mental health counseling. My last example comes from the research paper in psychopathology for Dr. Duckham. The subject for this paper was antisocial personality disorder. This assignment required us to look at the macro policy issues that affect those who suffer from our chosen psychopathology, as well as those who work with them. During my research, I found that this population is at risk because of our justice system. The destructive behaviors of this disorder lead adolescents and adults alike to incarceration, but the underlying issues are not being addressed. One of the main reasons for this is because there is not enough research for how to treat those with ASPD. With additional research, effective interventions could be developed so that these men and women could lead less destructive lives, which would decrease the social and financial burden for their disorder on micro, meso, and macro levels. Practice Behavior 3 relates to this assignment because of the critical thinking involved to analyze how current policies are failing this population. New policies involving research need to be formulated in order to advocate for policies and services that would advance the human rights for effective treatment and allow for social and economic justice for these individuals, their families, and taxpayers that pay for their incarceration and carry the burden for their offenses. My practicum internship this year is at Centerstone. Our service philosophy is delivering care that changes people's lives. Centerstone is currently in 5 states, including Illinois. The majority of our services revolve around mental health and substance abuse. There are many different programs within this agency. I'm working under the Family Services Program, which was new to our area this past fall. Our program is mostly funded by Illinois Medicaid, so we have to follow a state policy called Rule 132, which regulates how and when Centerstone gets reimbursed for services provided. It is a rule that determines many agency policies, so policy plays a big part in my practicum. The Family Services Program allows master's level counselors to go into schools, students' homes, and other community locations in order to help them and their families with behavioral or mental health issues. It is a program that allows a lot of freedom to the counselors to set their own schedules and interventions without being completely on their own. I was giving a small caseload of approximately 10 kids ranging in age from 6 to 18. For the majority of the cases, I go to their school, call them out of class, and sit down with them for 15 minutes to 1 hour, depending on the situation and attention span of the individual. Case notes have to be typed in within 24 hours of the service provided, per Rule 132. We use the IM CANs to do our assessments, which in turn determines the client's needs, goals, and objectives of treatment. Rule 132 determines these regulations and also other things such as how often their service plans must be reviewed. It was encouraging to me to connect a past assignment with what I was doing for practicum and what I will be doing full-time after graduation. My second example recommended school-based treatment for adolescents, and I have the privilege of doing just that. It is a very rewarding program, and I have gained much knowledge and many skills in the process.